Good morning and welcome to Webinar Wednesdays with Senior Medicare Patrol. We're glad to have you all with us here this morning. My name is Sunny Lawless and I'm the volunteer coordinator for our SMP programs. I'm going to be your host for this morning, and presenting today will be Gayla Yoakum and Shay Lewis, who are both community outreach specialists for us in Georgia. Today, for the September installment of Webinar Wednesdays, you're going to learn about home health and hospice fraud. During the presentation, you're welcome to type in any questions that you might have in the chat, but we are going to hold those until the end of the presentation when we open it up for Q&A. And then we'll also have a prize drawing for those of you who were registered to attend today prior to 10:15 a.m., and you must be present to win. Before we get started with today's presentation, I do need to let you know that this project was supported by the is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% funding by ACL-HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are an endorsement by ACL-HHS or the U.S. government. And just to give you a little history on our program and who is Senior Medicare Patrol, well, SMPs are grant-funded projects of the U.S. Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has an SMP program. In Georgia, Louisiana, and Mississippi, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Now, before I turn things over to Gayla and Shay, I do want to just take a quick poll. And our polling question for today is, do you know the difference between home health and hospice care? I'm going to go ahead and we'll launch the poll and give everybody a few seconds to answer. So yes or no, do you know the differences between home health and hospice care? All right, I'll just leave it open just a few more seconds. We still have a few folks who have not answered yet. Go ahead and get those in. Looks like we have about 80% have answered, so we're going to go with that. So it looks like 100% of you say yes, you do know the differences between home health and hospice care. So I'm going to turn things over to Gayla, who's going to look at the differences between the two services and share information on how fraud can occur with those services.
Thanks, Sunny. Welcome, everyone. Happy September. So there are several differences between home health and hospice care. In addition, there are some similarities that make it difficult for people to tell the difference between the two. Today, we are going to look at those differences to get a better understanding of those two types of care services and learn how to avoid becoming a victim of Medicare fraud. Next slide, please. First, we're going to discuss home health. Next slide. Home health is defined as a wide range of healthcare services that can be given in your home for an illness or an injury. It can be short-term or it can be longer-term. Next slide, please. Medicare covers most home health services that are considered, quote, reasonable and necessary, unquote, for the treatment of an illness or injury, usually after a hospital stay. The home health agency must be deemed Medicare certified. Home health agencies work with your doctor to evaluate your healthcare needs and tell you what home care services you need. To be eligible for these services, your doctor must certify you that you are homebound and require at least one of the covered services for Medicare. Next slide, please. Home health is for individuals who are expected to recover from either the illness or injury for which they are being treated. Some of the services that are covered by Medicare are skilled nursing care on a part-time or intermittent basis. This care must be performed by a registered nurse or a licensed practical nurse. Physical therapy, speech therapy, and occupational therapy. Home health aides services on a part-time or intermittent basis to assist you with things such as bathing, using the bathroom, or dressing. Medicare will not pay for anyone to assist you with household chores, such as vacuuming or washing clothes. Next slide, please. Durable medical equipment such as walkers, wheelchairs, or bedside commodes, and certain types of medical supplies like wound care dressings that are ordered as part of your care. Next slide, please. Now that we've covered the home health, we're going to talk a little bit about hospice care and their coverage. Next slide, please. So what is hospice care? It's really a special way of caring for people who are terminally ill. Hospice care involves a team-oriented approach that addresses the medical, physical, social, emotional, and spiritual needs of the patient. Hospice also provides support to the patient's family or caregiver. To qualify for hospice care, a hospice doctor or personal doctor must certify that you are terminally ill, meaning that you are not expected to live for more than 6 months, as well as homebound. When you agree to hospice care, you are agreeing to comfort care, also known as palliative care. Instead of care to cure your illness, you're basically agreeing for someone to help support you while you are going through your illness. You must also sign a statement choosing hospice care instead of other Medicare covered treatments for your terminal illness and related conditions. And I want to say, and you could probably follow this, but in Georgia, one of our most famous hospice care patients right now is Jimmy Carter. He's fixing to be 99, and he has been in hospice care for quite some time. Next slide, please. So let's talk a little bit about hospice care coverage. Coverage for hospice care may include the following: all items and services needed for pain relief and symptom management, medical, nursing, and social services, medications for pain management, and durable medical equipment for pain relief and symptom management. This may be things such as wheelchairs, electric hospital beds, bedside commodes, and things like that. Next slide, please. So with your hospice care, you are acknowledging that you are not going to get better, and therefore the focus is on giving you the best quality of life possible given your condition. In this case, you may have an aide come in to assist you with bathing, going to the bathroom, and any other personal hygiene care that you need. Hospice care also allows you to have homemaker services. This is someone who will assist you with things such as light housework, changing your bed, washing your dishes, or washing your clothes. This is one of the differences from home health. Next slide, please. Now that you know more about home health and hospice care coverage and the differences between the two, we're going to talk about the different types of fraud that can occur with these services. Next slide, please. The most common healthcare fraud scheme is when Medicare is billed for services such as physical therapy, occupational therapy, or speech therapy that were never actually provided. The beneficiary is asked to sign a blank form during a home visit. Never sign a blank form. This allows the agency to then bill Medicare for a variety of services that were never provided. Unscrupulous physicians may also fraudulently certify that a beneficiary is homebound when they are not. Sometimes the beneficiary is offered cash or other incentives to sign forms and allow the physician to charge Medicare for services that they did not perform. Another example of home health fraud is when Medicare is billed for skilled nursing care, but such care is not provided at all. Instead, the provider sends someone to the beneficiary's home to help with housekeeping and errands, but bills Medicare for skilled nursing services. Next slide, please. Hospice fraud occurs when Medicare is falsely billed for services that are defined as hospice care. Examples of hospice fraud may include a provider that is enrolling a patient in hospice care without the knowledge or permission of the patient or the family. Again, make sure that you do not sign any kind of blank forms at all. Also, a provider falsely certifying that the beneficiary is terminally ill. And remember, terminally ill means that your life expectancy is either 6 months or less if the disease runs its normal course. Another example of hospice fraud is a provider billing for a higher level of care. A higher level of care that's needed or provided, or billing for services that were just not provided at all. And then two more, lastly, for the hospice fraud is a provider keeping a beneficiary enrolled in hospice care for long periods of time without any medical justification. And lastly, providing inadequate or less care on the weekends and disregarding a beneficiary's plan of care. Those are the biggest examples of hospice fraud. Next slide, please. Now, let's talk about how to avoid home health and hospice fraud. Number one, again, never sign a blank form from your home health or hospice provider. Avoid any offers for gifts or cash in exchange for your Medicare number. If they offer you a gift card to get free groceries or something off the internet, something for free in exchange for your Medicare number, always say no. Also, make sure that you look at your Medicare summary notice and your EOBs to make sure that your Medicare has not been billed for home health or hospice services that you were not provided. You can keep up with that through our healthcare tracker that we provide you also. And if you need one, you can always let us know and we'll be happy to send you a healthcare tracker. Also, only agree to home health or hospice services if your doctor has certified you to receive those services. So make sure that you have that conversation with your doctor and that you're not signing anything blank, that you're avoiding the gifts in exchange for your Medicare number. You're looking at your Medicare summary notice, and you only agree to it if your doctor recommends it and is certified to you for those services. Next slide. Now that you know who we are and what we do, Shay is going to discuss the 3 keys to success in stopping healthcare fraud, waste, and abuse. Prevent, detect, and report. Shay?
All right, thank you so much, Gayla. Good morning, everyone. So we're going to go ahead and talk about the 3 keys to prevent Medicare fraud, errors, and abuse. The first one is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Treat your Medicare and your Social Security cards like your credit cards. Never give these numbers out to a stranger. Remember, Medicare won't call you to ask for your Medicare number. I'm going to repeat this again. Medicare won't call you to ask for your Medicare number. This is a very crucial one. And also, don't carry your Medicare card unless you'll need it for a doctor's appointment. Next slide. The second key is detect. Knowing how to spot suspicious activity can help you stop Medicare fraud and abuse in its tracks. Review your Medicare summary notice or your MSNs or your explanation of benefits, EOBs, from your insurance company. Your Medicare summary notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. Compare your statements to your personal records and look for the following items: charges for something you didn't get, billing for the same services or supplies twice, services that weren't ordered by your doctor. Next slide. The third and final key is report. If you suspect you have been a target of fraud, please report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, do not give out your personal information. Report the call immediately to SMP. If you have any questions about your Medicare statements, call your healthcare provider or your plan. If you aren't comfortable calling your provider or you just aren't satisfied with their response, again, call SMP. Next slide. Now, you might be wondering how you can help and become involved. Senior Medicare Patrol is always looking for civic-minded individuals to join the fight against Medicare fraud. The benefits of volunteering for our program include gaining the satisfaction of participating in a national effort to empower members of our community to prevent, detect, and report healthcare fraud, errors, and abuse. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in a bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible and is done on an as-needed basis. Volunteers are offered opportunities and have the option to decline if they are not available. They determine how often they would like to participate. We also want to mention that this is a great volunteering opportunity for couples. In the past, we have had couples team up to volunteer, give presentations, and attend community events. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number at 877-272-8720. We will love and be more than happy to send you one of our volunteer information packets and answer any questions you might have about the process. Next slide. As mentioned in the previous slides, we have a toll-free number at 877-272-8720. You can also visit our website, www.stopmedicarefraud.org, for additional information about our program. Additionally, we would like to encourage you to scan the QR code using the camera on your cell phone that will guide you to our social media platforms, including Facebook, which we have one for our different states, Georgia, Louisiana, Mississippi, and a Spanish Facebook page, our YouTube page, and our podcast, Sip and Learn with SMP on Spotify and Apple Podcasts. Next slide.
All right, thank you, Gayla and Shay, for the information on home health and hospice fraud, and also on prevent, detect, and report. Coming up next in our Webinar Wednesday series, we're going to cover open enrollment and fraud. This webinar is scheduled for October 25th at 10:30 Central Time. So be on the lookout for an invitation and register for that webinar soon. All right, so now it's time for our prize drawing. So everyone who was registered to attend today's webinar prior to 10:15 a.m. has been entered for a chance to win, and you must be present. And the winner of today's prize drawing will receive their choice of a $25 Walmart or Amazon gift card. So give me 1 second. Let me get that wheel pulled up. And a list of all the people we have on the line. Okay, I'm going to go ahead and give it a spin, and hopefully we'll have a winner. All right, it looks like Miss Susan N is our winner this morning. So congratulations, Susan. I will be reaching out to you to find out which gift card you'd like to receive after we wrap up the webinar today. Okay. All right. So before we wrap up, we want to open things up for questions. So if you have a question regarding any of the information that was presented today, please raise your hand. If you look to the right of your screen, you'll see a control panel that has a hand icon like the one that's on the screen now. And if you click on that hand icon, we can unmute your line and you can ask your question if you have one. Okay, well, I'm not seeing any hands raised. So this is going to conclude our presentation this morning on home health and hospice fraud. We will be sending an email after the webinar today with a link to a short survey. We would appreciate it if you would complete the survey to let ACL know how we did today. I also included that in the chat in case you wanted to go ahead and complete it now. And thank you again for joining us, and we hope to see you all again soon. Take care, everyone.
Sonny.
Hey, Sunny, we had a couple of people.
We had a hand raised? Okay.
Yes,
I'm
Miss
sorry.
Angela Jones, and then we had a question for Miss Linda.
Okay, sorry about that. I didn't see that. Let's see. Miss Angela, I've unmuted your line. Angela, did you have a question?
Well, I did. I didn't see my name on the spin thing. Was it on there?
Did you register before 10:15 this morning?
I sure did. I've been registered 3 or 4 days.
Okay. I can check and see. I put all the ones that I could see before 10:15 this morning. I had added them to it. Did you have a question about the presentation?
No, I didn't.
Okay. Okay, and it looks like Miss Linda Medine, you had your hand raised. Miss Linda, I've unmuted your line. You just have to unmute your phone and you can ask your question if you like.
Yes, I wanted to find out the difference between palliative care and hospice.
Okay. Monique, can you help us with that one?
Yes, I can, and Louise probably would be able to help a little bit with that too. So from my understanding, the palliative care is basically very similar to hospice. It's, considered comfort care without knowing that there is not going to be any cure for it. I think, Louise, is there a difference in terms of like the location as far as hospice and,
Yes.
okay,
Oftentimes, palliative care and hospice care, palliative care will kind of come right before hospice care. A lot of times in the hospital, they'll order a palliative care consult when a diagnosis has been made where decisions, we really want to understand what are the wishes of the family, the caregivers, the patient, and to make decisions towards that, their goals. And so you'll start with palliative care to understand what all the options are, including options for home health, including options for hospice, including, rehab, or whatever. So it's not making that terminal type decision regarding hospice, but really exploring what your wishes are, what your goals would be, how do you want to that quality of remaining, your remaining time to be, and so that everybody understands that and puts that together. So oftentimes, and I did case management in the hospital for many years, we would, when someone had a diagnosis would involve very serious.
I really can't hear her very well or him very well.
Yeah, I'm sorry about that. It looks like we lost our audio as well.
Right. Yeah.
Um,
okay,
other-
and one of the main
Well,
differences is like with the hospice care, it's usually provided, in a home-like setting, nursing home, assisted living facilities, but your palliative care typically is in a hospital setting.
Mhm.
Okay. I have another question, and is reference to a person that's going to be or feels, I guess, in hospice. That can be a long-term hospice. You said 6 months, but my mom was in hospice for a really long time. She had
Right.
Alzheimer's, and so she was in hospice for a long time.
Right.
And I don't know really, when a person goes into hospice, they don't go to the doctor any longer, but do they still take the medicines that the doctor had prescribed to them when they weren't in hospice?
I don't think they take any medicines as far as only comfort, to provide comfort care, from my understanding.
Right. Gotcha.
And
Okay.
you're correct. Sometimes it is longer than 6 months.
Right.
They have to be recertified in order to still qualify. But it often happens that they can be in hospice care for longer than the 6 months.
Correct. Gotcha. Okay.
Thank you for your question.
Uh-huh.
yes.
Thank y'all for the information too.
Oh, you're
No
welcome.
problem.
Okay. Well, I'm not seeing any other hands raised or any other questions coming through. So we will go ahead and wrap it up. And thank you all again for joining. And thank you for the questions at the end. And you'll get my email in a little bit, just as a thank you. So if you think of something else that you'd like to know, please feel free to reach out to us and we'll get the answer for you. Everyone have a great day. Thank you again.